Welcome to our special webinar series, COVID Warriors. I'm your host, Pallavi Arun Verma. The initiative taken up by ET, the purpose behind this whole exercise is to acknowledge the pivotal role played by people who have contributed in their own unique manner to the society and to the fight against COVID. In today's webinar, we want to focus how we have moved from me to we in the last 6 months. Our eminent speakers are going to talk about various topics like common categorization, sharing things, living together, and collective framing of a pandemic. It would be an honor to introduce every one of you. I would like to begin introducing our panelists. We have people from all walks of life. I would like to start with our youngest panelist, COVID warrior Rohan Bhojwani, who's 17 and is studying at American School, Bombay. COVID warrior Arjun Bafna, young and motivated entrepreneur who holds an MBA degree from Columbia University, New York, and heads the Bafna Group of Industries. COVID warrior Dr. Noreen Sharma, joint CEO, Guru Nanak Hospital, and head of Department Critical Care, COVID and non-COVID. And COVID warrior Rakesh Shetty, a Seva Dal national functionary and president of Ekta, the Power of Youth and Unity NGO of Mr. Rakesh Shetty. I welcome all of you on this special webinar. I'm also being joined by our special guest, Sarah Afrin Khan, who's an actor, who is an activist and author, a TEDx speaker. Sarah, welcome to the special series on COVID warriors.
Thank you.
So let me begin with Rohan first. As we know, COVID has had its impact on everyone, be it a young person, students, college-going students, people who are planning something new this time, beginning of their careers. Everyone is in a limbo. Be it the people who've been going to offices, and people who have been on the ground like since day one, especially people like Dr. Sharma, who've been on the front line. So, since you're the youngest member on the panel, just a quick take from you. How have you taken this up, and how have you been able to cope up with the whole scenario? Tell us something more about you. We know you're into music for a very long time. Something more if you can share with us, with our audiences.
Absolutely. So, related to the music, I have been studying the violin for, sorry, there's some feedback. I've been studying the violin for 10 years now, and I'm very into music, and that's why I decided to bring it to my charity and my CSR. And how I went through kind of COVID and stuff like that was how I firstly want to focus on myself. So I just thought of it as, look, everyone's in the situation. I'm just going to go about my studying and my schooling just like it would be normal. So I would get up early in the morning, even though I had no reason to. I would still get up as early as I would, just to keep track of schedule and just not to let myself like go, because a lot of people, including my family members, were just deciding to wake up late, sleep really late. And everyone's schedule just got a bit, because there was not really any purpose to get up. So I had to force myself to get up and kind of just stay on schedule. So I feel like staying on schedule was kind of what kept me on track. But what I was also doing during COVID was, before COVID, I had been teaching students at the Lakshmi Agar school. I would have been teaching 14 students how to play the violin. And COVID had hit sadly before their concert, which I was prepping them along with a Japanese violinist who was my old teacher, Mika Nishimura. And we were prepping them to play for a concert, but then COVID had hit. So we decided to basically fundraise for these students, because most of these students' parents are employed in the informal sector. 67% of all Akanksha students are daily wagers, so they had no income when COVID hit. And it was very sad to see how I was I was first angry, like, oh, I have to log on to Zoom for my classes, and oh, it's just COVID has hit me really hard, when actually these people were letting me know how they had no access to food and water. And it just shows how different the levels of privilege that we have, and how I wanted to help these students who had become my friends. So I decided to fundraise for their food and water. And post that now, so they were at least in a safe space during quarantine. They weren't really thriving, but they were surviving. And post-COVID, sorry, not post-COVID, but post August, now school's starting, because obviously everyone's school is starting. And what a lot of my friends and I can do is we can just log on to Zoom, and it's very easy for us. So with these students, they have no access to devices, they have no access to any sort of way to get to class, because a lot of them just share one device in the whole house. So what I decided to partner with Akanksha and do is raise tablets for not just my students, but for all the Akanksha students, and record and starting to record some of my own music lessons so that many more students can kind of learn music if they choose to. So far, I've personally raised around 15 lakhs, so that's 150 tablets. So now 150 Akanksha students now have access to their classes, to new apps, to new types of learning, as well as to my music lessons. So I've managed to broaden it kind of from the 14 students to now 130 when we launched the music lessons. So that's kind of what I've been doing during COVID.
Great initiative. In fact, I would now like to go to Mr. Shetty. Mr. Shetty, you've been into politics for a very, very long time. So, and you've also been a youth, you are a youth leader, of course. So how do you look at yourself? You feel, you think yourself as a, what do you feel as a politician, as a social activist? You've been on the ground like since day one, as we were discussing in the beginning of the session. Tell us something more about the NGO and what all activities that Ekta has been doing, especially during the pandemic.
Ekta, the power of youth and unity, this NGO, basically it was started with the agenda to curb corruption. And I
Okay.
have around 2,000 young and dynamic youth who are connected with me. And we ensure that to be the voice of the last person in the room who doesn't have influence and money power to raise his voice. So when this COVID thing started, like the first, we all know that first day when it was I think the Janta curfew, that was
Right.
fine, and the first phase was cool because the entire March month people had worked, they were getting their salary on time and everything. But the problem started on the second phase. As soon as the second phase started, we started receiving complaints from this migrant laborers, construction workers, because it was a long period. Like after 21 days, these workers were asked to leave, vacate their houses. And as you are aware that this construction sites were stopped, daily wages, they were not getting work, so there was no income, so they were unable to pay their rent, no money was left with them for food and everything. So what we did was we gathered around 200 volunteers from this Mumbai northeast region, that is Mulund, Bandup and all these areas. And most of the maximum area, if you see in this region, is slum. So what we did was we started distributing food grain kits to these people, and I am very much proud and I am thankful to all the donors that we were able to cater more than 10,000 families during this period, and this we have been doing it for last 3 months now. And if
Great.
you see the overall situation now, day by day, as government has started the unlock system. Today morning, what I see in papers is like in one day we have detected more than 75,000 cases in a single day, and which is very shocking. And if you see the graph, if you see Maharashtra, we have lost more than 25,000 people only during this 4 months period, and I think we are the highest across this country. So I think now it is high time that pharmaceutical companies should come out with some solution, because day by day the things will get worse, and we are in process of unlocking because we are forced to do it because the economy is going down. But apart from that, we even need to see what is the dangers which is in front of us, because we are fighting with a virus where we don't have any solution except for increasing our immune system. So I think the situation is bad and we need to look for some alternative, very quick solution people should come out with. That what is the prayers, what I am doing now.
Sure. In fact, I would like to take a quick reaction to Dr. Sharma as well. Dr. Sharma, you are not only heading the department, you have also taken an initiative of a special dedicated center for COVID patients. So could you tell us more about that, and what was the first reaction of your family members? We've learned that you've not visited home for last 4-5 months. So tell us more about it.
Yeah, when the lockdown started, the fear among the grassroots workers started that the trains are not going to run for 21 days. So at least 50% of the workers had stopped coming to the hospital. So we were reduced with 50% staff. At the same time, the BMC approached us for a ward for their warriors, means their employees, police and BMC officials. So our trust took a collective decision. Our convener, Mr. Bhupinder Singh Manas, chairman, Mr. Sarabjit Singh, they all sat and they took a collective decision that we should go ahead with them. So we gave them initially a 50-bedded isolation ward with complete oxygen facilities and everything. So we gave them a full flow. We started with that. A lot of hurdles had come in the way because the staff were not ready to join. The staff had their own issues of traveling, of eating, of going home back and getting quarantined. The family members getting quarantined because initially the fear was so much that anybody who's seen a corona patient will get quarantined. So the fear was
Right.
more. The fear was killing the health workers. The more than the disease, the fear was killing. The fear of not going to the hospital, the fear of not working. That fear was more. But our few of our employees took the initiative. We will go ahead. We started with selective, our doctors team. Everybody took our RMOs. They all have taken their dedication, and we started the flow. The flow started. The first day it got filled up. Complete all 50 beds. They were all police officials and BMC officials. Definitely their expectation was more, and it was our first. We had not seen corona. That was the first experience. Whatever we had read from the papers, from the publishing houses, that only was a knowledge. As time went, we started understanding it now. We are not taking now that seriously. What initially it was, the fear factor and everything is gone now. Practically, if you'll ask me now, it's 4.5 months. I am staying in the hospital. I'm not gone home for that reason only that my staff remains enthusiastic to do it. Otherwise, they will think if the CEO is gone, then why should we also stay? So everybody has been on their toes. Once our wards got systemized, we started 12-bedded COVID ICU also for the policemen and the BMC officials because they were not getting beds outside. They were struggling. People in the ambulances were dying because there were no beds. They cannot come to the normal ICU. Normal ICU, one patient comes positive, the whole ICU gets shut. Initially, the BMC proposals were that way that the hospitals used to get shut. One patient positive, the hospital is shut. So that fear factor was too much. So we had, our hospital was a small hospital with a limited facility. We had built a wall in the ICU because our ICU was a 24-bedded normal ICU. We built a wall in the middle and made 12-bedded separate COVID ICU. And we started with it. Today, if you'll ask me, we have treated nearly 1,100 patients of COVID. Out of that, we had 20 mortalities. And nearly everybody has gone home. Lot of problems have occurred. See, medicines are not available. What medicines to give is not decided. After 1 week, the decision, the protocols, the treatment protocols keep on changing. The testing protocols keep on changing. We are working, like if you'll ask me, I wake up at 6 o'clock in the morning, I sleep at 12 o'clock. After 12 to 6 also in the night, I'm taking phone calls. 100 of phone calls coming from the PMC, coming from everywhere. We're sending a patient, this, relatives calling. So life in this 4 months has taught a lot of things. But we are not stressed out by the work. We have enjoyed the work. None of my employees have stressed out. Whoever are working in the COVID, they all have enjoyed. All my doctors have enjoyed. They have not complained till date. They have not taken a single holiday till date in last 4 months. They are all staying with me and they are really working very hard. Everybody has to think. Healthcare workers are also getting exposed. In fact, in our hospital officials, 25 people got positive. That fear of 25 people, the other people stop coming. But we have to build the confidence in them. After all, it's a fight for the nation. You have to fight it.
Absolutely.
And you have to
in fact, passion. Absolutely. Please.
Yeah, it's a passion. If you say it's a passion, I enjoy it. If you'll ask me, if somebody does meet a corona patient, I go and meet him. I sit with him. We had a birthday party of a policeman. We had a dance party. It was viral on the YouTube. We had a dance party on the floor in the COVID ward.
Right.
Now we are
In fact,
planning.
you correctly mentioned passion. In fact, Sarah, passion is the thing which keeps us going. And you have been meeting a lot of people from different ages. Like you have worked with teenagers, you work with middle-aged women, you work with old-age women. So tell us firstly about your own journey. What inspired you to inspire others and make such life-altering changes? Tell us more about yourself and to the audiences.
See, to me, the trust of my hospital trust. They told me, okay, Sharma, we have to start. I had a fear my
Okay.
family would agree. My family was very reluctant. My two daughters, they were like, we promise you are not going to go to COVID ward. I told them I'm not going to go. I'm just staying in the
Great.
hospital for the sake of staying. And slowly, some of my videos got viral of in the COVID ward and they came to know. Then they started arguing with me.
You have been doing a fantastic job, sir. Yes.
Pardon?
Arjun, you wanted to add something. Arjun wanted to add something. Please go ahead, Arjun.
So in this 4 months, I had my daughter's birthday, my wife's birthday went 2 days back. I could not attend them, but they accepted now. Now they are confident that you will beat it. Now they don't stop me. Now they say, okay, Papa, go ahead. You can do it. Now they have no hidden things. Now anybody tells them Corona, they say, no, Papa is fighting. Papa has the guts, he'll do. So now they are not worried. So now that gives me more freedom to do. Initially, even I was in my limitations. So the trust of the hospital, my friends, and my family all have supported me. Last 5 months, they never told me you come home. They told me you take a decision whenever you feel it is safe to come home. That will be your decision. But whenever you come, take a 7 days leave and come. That is what we would like. So I'm okay with that. I told them it's fine. Another 2 months, maybe things will be the same for me. 2 months afterwards, I'm expecting we will have some downfall. But things
Doctor,
really have been
just
good.
to interrupt you. Just to interrupt you, I would like to take a little reaction from the other panelists also. They're also waiting. So let me come to Sarah first. Sarah, as we talked about passion, and Dr. Sharma also mentioned this, that passion is what keeps us going. Then we don't worry what is the condition, and we might be exposed to things like that. But on a different level, on the mental level, if I may speak to you, you are an inspirational speaker, and you have been working with different groups of people. You work with teenagers, you work with middle-aged women, women of different ages, right? So could you tell us how you started and what inspired you to inspire others?
So first of all, I mean, I would like to acknowledge Dr. Narendra Sharma. I mean, being on the first line of duty, it's like, only a passionate person can go ahead and, completely help the COVID patients when the entire country is living under fear.
Sure.
Similarly, we were actually shocked, me and my husband, because we wanted to be out there helping people on the mental level, because what we understand was in India, they were only allowing the doctors to go ahead and help. And we were struggling with it because there were a lot of people calling us, emailing us, and we were like, the first few days, believe me, we were non-stop on the calls and emails, trying to convince people, trying to get their, sort of mental health a bit stable, because obviously this has never happened before. When the lockdown was declared for 1 day, it was still okay. We understood. But when it like extended, we never even comprehended that, in our lives, that a situation like that would come up, that we would be all in lockdown. And imagine India, where you would look outside the window and not a single soul outside. And that actually made people even more, even more fear within them. Because even I was, for a few days in fear, thinking, oh my God, is this for real? It just reminded me of those zombie town movies, like one spreads the infection to another and another, those vampire zombie films. So it was like that. And then we started contacting the news people, and I think Ashtak and a lot of the other television news, they start contacting us and saying, how can you help? So we decided that we at least can broadcast, things that we can do to help people while they're sitting at home, because it was just the fear of unknown. Okay, you have COVID-19. How long will this lockdown continue? How serious it is? And can we see, how people are dying or how people are living? So first we started uh, giving interviews in the channels. And then luckily a lot of organizations started contacting us, and some actors started contacting us, all to do with how we are going to be mentally prepared for this. We took them step by step in the procedure. Like for instance, the first step, changing your mental state, easiest step is to change your physical state. You move about, because in this lockdown, everyone was sort of settled. We didn't want to get out of the bed, or we didn't want to get out of watching Netflix, or we didn't want to get out of social media, because we have all the time in the world. Now, what
Right.
happens when somewhere down the line your mind is so relaxed that even though you're watching Netflix or you're on social media, you will keep thinking of the worst. And that will only put you low state, which will be easily visible in your body language. So the first
Right.
thing that I tell everybody, from teenagers to children to elderly, to change your physical state. Stand up and do something, move around,
Right.
maybe dance, maybe collectively do some exercise, play games, something, because the first thing that will attack you and your system is your physical state. Everybody was sitting like this, there was no movement obviously, and everybody had this blame game, though we can't do anything, we can't go out, but there's a lot of things you can do in the house. Somebody needed to tell them, somebody needed to shake them up. Now, this was the easiest thing to do, is to basically change your state. Second, which is a little more tougher than the first step, is, as humans, we have about 50 to 70 thoughts running in our mind every single day. And if you notice, if you actually listen to yourself and pause and think about the thoughts that you're thinking, it's actually repetitive thoughts. So all of a sudden, during this pandemic, you developed a different set of thoughts, and those thoughts were repetitive every single day. My life is ruined. What am I going to do? My career is gone. I'm not making money. My business is shut. Constantly, that chitter chatter of negativity was making your entire system completely low to the ground. So, what we were encouraging, and what we were encouraging ourselves as well, because every time you pick up the phone, talk to people, you're reminding yourself more as well that we need to do this as well, because we're humans as well. We need to help ourselves as well. So the thing was that we have to concentrate on the thought process and have a great conversation with yourself. You know, saying all this, everybody must have heard, think positive, do this. We don't believe in thinking positive. We don't believe in thinking positive, because if there is a tsunami happening, you're going to think, you're sitting in the house and thinking everything is going to be okay. That's thinking foolish, not positive. We encourage people, yes.
Sure, sure. Just to add to your point, in fact, that should has to come every day. Like we cannot be thinking, in a negative manner, and suddenly out of the blue we might be, beginning with saying that today I'm going to think positive. So let me take a reaction from other panelists as well. Arjun, I would like to know from you, what has been the impact of COVID on you on a personal front as well as professional grounds, and how the BAFNA group has integrated in other countries. How have you been helping people in this pandemic?
Sure. So I'll start with the personal front first. Obviously, like what Sarah and everyone else mentioned, that it was a complete mental breakdown. I'm not used to personally staying at home. I travel 15 days a month all over the world, and then we had, like me, a lot of other people had to make or were forced to stay at home. And all these thoughts about what's going to happen to the business, how we're going to handle it, what about my team, all the employees and the staff that we have, how are they going to manage it? We were really concerned about how, when the revenues stop, when nothing goes in their pocket, how are they going to feed themselves and their families? So we took corrective steps there. But on the professional side, I'd like to add that we have a company called BAFNA Healthcare, and as soon as we saw that these cases are spiking, we ramped up our production for making ambulances. We are one of the largest ambulance manufacturers in the country. But this was kind of a preemptive step. But for COVID, we also made isolation booths, so we could isolate patients without harming everybody else. And we also strategize what we are going to do when things normalize, like today, that you have to maintain your hygiene and sanitization processes. So we have a site sanitization tunnel. So we invested our time energy into making these products and trying to contribute towards this pandemic so that we can all come out of it together. So, I mean,
Sure.
these were the steps that we took. On the personal side, again, uh, like Rohan mentioned, that everybody started getting up late. We had nothing else to do. We sleep late, get up late. That lasted for around 30 to 40 days for me personally. But then I got my act together, started getting up early, getting back in shape. So if I'm physically fit, I'm mentally fit. And if I'm mentally fit, I can make the correct decisions and contribute correct towards the society. In fact, we have a couple of COVID warriors in our building. Our building was actually, we had 23 cases, and the entire building was under lockdown. And at that time, me and a couple of other boys in the building stepped up, and we were doing all the jobs, from taking deliveries from the gate, making all the watchmen had COVID, so they were sent to the centers, the COVID centers, and for isolation. So we were actually taking rounds to ensure the safety and security of the building was taken care of. So these are the kind of steps that we collectively took. One good thing I want to mention in this entire pandemic that has happened is many of us have found extended families, our neighbors.
Yes.
We never thought how
Yes.
important our neighbors are, but in this time, those were the only people we could interact with. And today I can proudly say that I found one of the best peoples that I know through my neighbors. And we all are one community, making sure that we contribute to the society and are responsible towards towards coming out of this pandemic.
Yes, definitely. In fact, Mr. Shetty, I would like to know from you what has been your personal journey or so far, any particular incident that you would like to share here on this platform, any anecdote, anything, Mr. Shetty?
Yeah, see, as soon as I mentioned, like when we started off this distribution of food grain kits, and we started two centers in Mulund and Bandu to ensure to do COVID test with the help of the doctors. And
Mm-hmm.
for everything there was cost involved, and due to pandemic situation, everyone was like at home. No one had access to the funds also, because CSR activity was closed and everything. In this entire process, you read my piece that in economic times also, like I had a
Right.
second home at Kalyan, which during this pandemic period I have to sell it off for something like 60-65 lakhs, and that money was brought into the NGO to just to pass up, because this food grain activity, it took a lot of money, because for one family around we used to spend around 7 to 800, and we had targeted more than 10,000 families. So
Okay.
this was a personal we contributed during this pandemic period. But apart from that, there are so many corporate who helped us, who came up. The best part, what how Mr. Bafna said, that during this period we realized, like celebrity, they came out with the donations, NGOs they contributed, individuals who never did donations, they came out with the extended hand. So there were so many positive things which we could take it out from this period. So people who never came on street started their NGO, came down, contributed whatever resources they had. So the journey was fantastic if we see in both the front. But as far the government goes, government was new, but still it failed, to like for example, migrant workers. They thousands of kilometers they went on street with their family, with their babies. Government failed to
Right.
provide them transportation, food and water. This basic thing government should have done. I am a part of the government, because as you know there are three parties involved today. But I take full responsibility that this was new to the government, and even the government has never expected this type of situation. But at many
Absolutely.
fronts, government should have taken measures, like for example, we failed to keep a tab on the essential commodities. Middlemen
Right.
and some black marketeers, they inflated the price, which was too bad, because getting in the month of May and June, it was very difficult for people to go to supermarket and get this groceries, because there was
Right.
inflation prices. Some hospital, like I salute Narendra Sharma for contributing his stamp. There are such good doctors, but few private hospitals, they played with the life of the people. I had to personally visit hospitals, fight with the doctors. During this entire process, 3 FIR was filed against me, just for because because the patients, you are giving them bills like 15 lakhs, 16 lakhs per patient for 15 days. And what people realize, even after paying hefty premiums to the insurance company, PPE kit were not covered. You all are
Right.
aware of it. And due to which, you know what, every day thousands of money used to go in this PPE kits. So I think few people, like even government, failed to give PPE kits to their own employees. So many police officials, BMC officers have lost their life in this. Even the doctors have lost. And today I read in the morning, like the first that lady, like one of the doctor has lost her life today. So
Right.
she's I think 103 years old, first cardio surgeon in this country. Even she lost for COVID. So this time is like taking toll of us, and there has to be some solution which should, because like as of today, if we see the cases have gone up. So what is the solution? If you ask me, I recommend strictly 21 days complete lockdown should be there. Then only you can tackle
Okay.
it,
Okay.
because now you're coming up with the process of unlocking the system. But
Mhm.
it will, Dr. Narendra Sharma will agree with me. As soon as more and more people come out, metros will start. This is going to spread like anything.
Right, right. In fact, Mr. Sharma, I would like to ask from you, as you mentioned in the beginning, you have been, working relentlessly and staying away from home and things like that. So any specific memory, any story that you have that has touched you personally, any incident with any of your patients who have recovered while they were going back home, anything that you would like to share on this platform?
Yeah, many patients, like young patient. I had a patient who was 8 years. The day he
Okay.
came, he just told me, "I'll go home or not." I told him, "You will go home." He told him 100%. I told him, "Yeah." After 10 days, he went home. He sent me a card
Oh,
saying
great.
thank you. Another lady I had 92 years. She never knew Hindi, English, only Marathi.
Okay.
Only thing she said, मी घरी जाणार की नाही. The only thing. And today she is at home. Today also I have one 91 years girl lady. Thursday she'll go home. When they come, they are in pain because of the media publicity that this disease will kill. See, one
Okay.
thing what I feel is all the news channels should stop showing that there is so much rise of cases. This is making a
There
fear
should be some
factor.
sensitivity to be dealt with this issue. It should be shown with more sensitivity, I think.
Don't show it every half hourly. At least give some gap. A person is
Right.
continuously seeing all the channels 70,000, 80,000, 90,000, 3,000 deaths, 4,000 deaths. So that's breaking of the fear. The person who is lying on bed, he's watching the TV and he's seeing it. And he
Right,
fears
right,
it.
right.
He fears because there is no treatment for it. Everybody is shouting in the panelists, there is no treatment. He fears when there is no treatment, what will happen to me? That's another fear.
So could you
So
tell us how has been the recovery rate, and you think India has handled the situation nicely? I mean, if we take a
India,
generic view.
India has handled the situation very, if you'll ask me, efficiently. Otherwise, we
Okay.
have a big population. In
Mm-hmm.
Maharashtra only, our mortality would have been very high. But we have been able to control it just because we have been able to control it only because we have been making patients isolated. The only wrong thing happened was in the starting phase when the whole building was made quarantine. That has
Mm-hmm.
created a fear factor. See, people fear to do the test only
Right.
because of the social reason.
Mm-hmm.
Socially, they feel that people will start saying, we should not touch this patient, we should not do this, we should not do that. That fear factor has made them. Otherwise, last 4 months have taught me nothing is different with a corona patient and a normal patient. You just maintain a social distance, nothing more is required. That is
Okay.
what we have
Okay.
been doing it. Luckily, I don't know, I might have got the disease and gone away also. Because 4 months, no doctor has survived in India who has not got the disease, treating it without a
Mm-hmm.
break. Otherwise, the government only is 15 days work, 15 days off. We are
Right.
not allowed to work so much, but we are working at a stretch
Mm-hmm.
because the load is too high right now. Right now, as I don't have beds in my hospital, the load is too high. So the fear factor should go, and the disease is treatable. definitely immunity has to be built up. That factor
Right,
has to
right,
be removed. You have to do whatever things can build up your immunity.
right.
Whatever from the grandfather, grandmother time, they say chaman prash and all those things. Whatever you try, it's helping or not helping today, you can't think about it. Because today everybody is studying the disease. Next year you will come to know the result, whether it was correct or wrong. Today defining yourself, what I did is correct, what I did is wrong, nothing has no value. Because today there is no
Yeah,
evidence for it. Whatever you are
yeah.
doing today, next year you will come to know the result. The same thing is your vaccination. Vaccination in a hurry, every country is going ahead. Ideally, it will need 5 years to understand whether the vaccine is really working or not. But today we don't have that time. That's why we have to be in a hurry. But to save life, you have to do it. Save
Right.
humanity, you have to do it. And the disease is 100% curable. Mortality is hardly in India 1.8%, which is
So we have
very
to
low
keep our
comparison to other
sanity
world.
and we have to keep our positivity as well. The point which you raised,
Positivity.
Dr. Sharma, yes, yes. So the point which you raised, Dr. Sharma, about the television thing, there's another very, bigger aspect of this whole lockdown is the social media and our presence on this. So I would like to now go to Rohan. And Rohan, if you could tell us, were there any problems, were there any challenges that you faced as you're associated with Akanksha School, and also tell us about how you have been handling the menace called social media, because there also we see a lot of updates, not just television, but people keep seeing the updates on the social media also, and that also impacts them. So tell us your experience on this.
Oh, absolutely, Pallavi. Thank you. So, my experience with social media has been, well, all teenagers like myself, we're constantly on social media, we're always checking it. And especially now, it does create a sort of issue. Like, not just looking at the mental state, just looking at the statistics. Every second post is about coronavirus. You're seeing some story. I mean, some things are helpful, but other
Mhm.
things are just constant stories about how people are having a lot of trouble, how you should wear masks, how you should be safe. And I feel like in my community, it's created a lot of stress and a lot of undue, like Dr. Sharma had stated, fear. And Dr. Sharma is the expert on COVID here, but I feel like this has caused a lot of people to do a lot of unnecessary things, which are really taking away from the health workers. So I know personally so many people who are hoarding N95s, who are stocking up food, who are buying ventilators and PPE suits. And I feel like a lot of the fear is being spread through social media because I have personal friends who, during social media, are saying that ventilators are most helpful for coronavirus and are buying them. But what they don't realize is the actual information out there is these need to be there for the health workers and for the actual
Right.
people who have COVID. So I feel like social media, it was helpful maybe to catch up with friends, but it's gotten to this point where it's
Become
grossly
a
spreading
menace.
misinformation
Yes, yes.
because there is no way to stop what you're saying because there's no kind of, I mean, there is restrictions, but it's so minimal that no one can really stop the information from spreading. There are so many fake WhatsApp stories, so many chats on my family group with my grandparents who are saying if you do 10 Surya Namaskars, everything will be okay. There are so much false information out there. If you pray to Sai Baba, it'll all be good. Like, I feel like there needs to be some amount of truth, and that's why I feel social media during this time, along with COVID, it's not been great for the fear. So that's why I try to limit my exposure on social
So,
media,
so
not
does
just for
music
that.
help? So does music help in keeping your sanity and keeping yourself productive? Tell us something about your musical journey.
Absolutely. So music for me, it's very stress relieving. It's very kind of just to relax. It's my passion. And I feel like for people who are at home and who are stuck or just people anywhere, I think a passion is really important at this time. Like I was talking previously to Mr. Bafna, who was telling me about his drums and how that's what excites him and how I play the violin. That excites me. And I look forward to that. Luckily for Dr. Narendra Sharma, his passion is saving lives, which is very helpful for all of us. And Miss Khan, it's her passion is helping people as a life coach and helping people actually recover during this very tough time. And for Mr. Shetty, it's helping people who are unfortunate. So it's very lucky that our passions are actually to help people, but I think people really need that passion, because without that passion, I think people start to go a little stir crazy and get some cabin fever. Because
So the
myself, if
common
I didn't have,
factor remains the passion, like that all of us
absolutely.
carry, all of us carry. So Arjun, I would like to come to you now. Rohan told us about the drum thing. Could you tell us about something more about the initiatives that you've taken up? We've learned that you've helped people in Odisha. You're in Mumbai. So could you tell us how this connection went on and what else have you been doing lately?
So in Mumbai, we actually supported a lot of the policemen, and we provided them with a lot of food and water, the basic necessities. They were really doing, going out of the way, risking their lives and ensuring that everyone else is safe, and
Mm-hmm.
kind of, trying to follow protocols. I mean, we as citizens, we need to be more responsible and value their inputs and value what they do.
Mm-hmm.
How hard they work to make sure our safety. They're doing it for us. Also, a couple of NGOs and some local karyakartas in Orissa, we have some business there, and they reached out to us. And there was a situation where there were a lot of kids that were going hungry. So we have ensured that they won't go hungry, and we provide almost 100 kids every day for the next 3 months meals 3 times, so that I mean, they're kids. They have no other source of rationing as such. So we make sure that they are provided for that.
Yeah. Sarah, I would like to come to you now, and we've already talked about a lot of stuff on the mental health aspect, and also as we know that especially during this lockdown, a lot of cases of suicide, they came to light. Although, as we can learn from other data and other numbers that keep coming in, that the suicide rate in India, it's terrible, and there have already been campaigns around it, but specifically in this lockdown period we see more of it and people started talking about mental health. So tell us about your book I Am Worth It, because we know that it's about motivating women specifically, and I think they've been on the receiving end during the lockdown, because since we all know they many of them, they had been working from home, for home, and other stuff. So they specifically they were exposed to a lot of mental as well as physical exertion. So could you tell us about your initiatives as well as the book?
Sure, Pallavi. Just want to say that, like Dr. Sharma said that about fear. First, I would like to cover a bit of fear. That I just feel that initially everything was so hyped up that even if, let's say, you don't have COVID, people started believing with a little sneeze and a cough that, oh my God, I must be having COVID. Or if you're, as if it was through telephone that I'm going to get COVID as well. It was that fearful. Everybody was
Right.
quite, and it is a catch-22 situation in India, because you don't want to spread the fear, because the fear will aggravate more and maybe people will fall sick even more. But at the same time, as I was speaking to the channels, they told me we have to inculcate this fear, otherwise India being the population so much, the people just want to get out there, they will not be able to hold back and stay in their house. So it was like, what you believe. And as Rohan rightly said, there were so many messages. All of a sudden, everybody became a COVID expert. That when you do this, there were some messages that with the steam, this will happen. With this, that will happen. Everybody's putting their steamers, and So yeah, that was a bit crazy. So handling that was a tough one. When it comes to my book, it's obviously catered for women. I'm worth it, but it's only catered. I've only said that it's catered for women because I didn't want to go for this women empowerment. I think that is totally crap. So let's that's another subject. Why it is for women? Because only if you have self issues, self-worth issues, self-doubt issues, will you start comparing yourself with maybe other sex, or similar sex. So in that I have clearly mentioned, which is useful for everyone in self-doubt. Things like the conversation that you have with yourself. Only if you have an empowering conversation with yourself will you actually help yourself. In this situation, linking my book and COVID, I feel that everything is to do with within. Your self-worth and self-value and your health and everything else is not outside what you do. It's what you think inside first.
Right.
External factors will value obviously, but first is the internal value, what you think of yourself. So my whole entire journey of this book is about how a person, how a woman thinks of herself in her internal mind. So her self-value does not depend on what her family says or the job she has, because I have seen in this industry of actors, of few actors that I have been a fan of, when I actually met them one to one, they have unfortunately quite a low self-value about themselves. And I think this attracts more stress, and this attracts like more disease, to be very honest. So this is the subject about my book, and this is how I think I relate to COVID as well. So it's mostly that drives people insane. I know that certain amount of fear is needed, but there was too much fear that has been inculcated in our society. People started behaving like crazy as well. I remember one incident where from the lift, I just went to the car, which is hardly 7, 8 steps, okay, initially, without the mask. I had the mask in my hand, just in the car. My people in the building called the cops on me. So I was like, are you for real? Like, really? So there were such incidents that were happening, and I was like, this is gonna drive people to another level. And they were driving themselves mad, to be very honest. I don't know if you all agree with me. You must have seen Arjun, tell me something if you have experienced such a thing where you have seen people behaving completely crazy just because of fear out of corona. It was just going crazy. That's all I have to say. So too much fear was, I think, too much to handle.
I think we've already passed that initial phase of hiccups, and as all of the panelists would agree that initially we were fighting with an unknown enemy, but now that we are almost 6 months into this situation, and now is the time when we need to look ahead. We need to think how we are going to cope up with the next 6 months, or some more time, because as we were learning that WHO has said that it might take maybe a couple of years to for things to get normal. So now is the time to be prepared for the future. So, Mr. Shetty, one thing I would like to know from you. We have all been talking about the passion that one should have, and how we should be driven and things like that. But for you, on a personal level, has there been any moment which has been a bit tricky or difficult period for you? Any incident that you would like to share, which kind of touched you very personally, very to your heart? And what would you like to say to people who would like to follow your footsteps and maybe join an NGO and would like to work and would like to help people who are really in need at this point in time?
See, it is a very heartbreaking moment when people come to us with for help, and we get them admitted in hospitals. And there were many incidents where, like, morning I've spoken to the patient, and within a day or two, we get a very bad result, and where the family members contact us and say he's no more. And this has happened a lot with me, like in this past four, I think 10 to 15 patients are there, like, who I had met them, I spoke to the doctors, they got them admitted, and this was the result. So when you do this social cause, you have to have a relation with the people who come for help and everything. And the moment you hear that they are no more with this, and we were part of their journey, to getting them admitted, and it's really a bad moment for us. But next day again, we need to come down, work for others. But sometimes we feel very bad and emotional to face such a situation.
Right, right. So you think, God forbid, we shouldn't be facing such situation in the future. But now that it's still ongoing, and you were saying that now that we are opening up, there might be problems further. Yeah.
And my opinion is, like, the doctors will agree with it. As Narendra Sharma said, one thing we need to understand is the social distancing.
Right,
But
right.
as soon as the metro starts, or the gym starts, or any other activity starts, how are you going to maintain the social distance?
Right, right.
That's the question. And after that, and because you know what, in the month of June and July, even after having money, there are no beds available in private hospitals. Even
Mm-hmm.
after having a 30 lakh insurance, you don't get a bed in private hospital. Where are you going to treat yourself? So even money is not going to help unless and until this infrastructure is developed. Narendra Sharma ji will agree. In the month of June, we were short of ventilators. People were unable to get ventilators. Even today, you call up because for one patient, I used to call around 10 hospitals. Everywhere they used to say, we don't have a single bed available. Then we need to request them, then some arrangement those doctors used to do and accommodate. So even after having 30-40 lakhs in your account will not help you in this pandemic situation.
Right.
So that's what we are facing right now. So see, the people who are poor, government is taking care. There are facilities, there are quarantine centers, everything. But the people, middle class and higher middle class, who can't adjust in that atmosphere, you don't get private hospital doesn't have enough bed. Actually, during this entire pandemic situation, a bad health infrastructure has been exposed. We are not ready for such a pandemic right now, but in future, God forbid, such things should not happen. But in future, we may be ready. But right now, we are not ready for this.
There is
Okay. So
understanding that I feel here about the social distancing. When we say that when gyms open, when the metros start opening, then there'll be no social distancing. But I'm not seeing any social distancing even right now. If you get out of the house, you see the parks, you see Juhu Beach, you see the promenade, you see Bandra, they're full of people. And if you see in Dharavi and all, people are even wearing, roaming around with the masks. So I don't know if COVID is spreading just because of social distancing, or is there something more to it? How come they're not catching? And then we will all sudden catch when the gyms and restaurants are opening. In fact, internationally, everything is opened. They're giving even discounts in restaurants and cafes, encouraging people to come. So I don't know how this is working. To be very honest, there's obviously more to just social.
Sure. Dr. Sharma, in fact, how do you see things from the day we started, like how this began in March, and now that we are entering into September? What is the difference in the way we are handling in terms of, as we were talking about the shortages and how we cope up with that, plus how patients are now reacting to it? Because now we see a great percentage, good percentage of people are also recovering, going back home. So as a doctor, how do you see the situation from the start till now?
No, now definitely the treatment part, everything has changed totally. And now we are not of a fear. People are also losing their fear. Now they are preferring more home quarantine. Except the BMC rule that anybody is above 50 should be in the institute or in the dome where they are provided. Otherwise, most of the people are going for home quarantine. And they are managing it well. That's why all the hospital loads have come down. That's why now the beds are freely available. One more myth about the corona thing is the ventilator. Ventilator is the last thing in the corona. It is most of the time what you require is a high flow of oxygen. So the problem with the hospitals where the oxygen supply. See, none of the hospitals manufacture oxygen. They have a plant and the plant is filled every day. Like in our hospital, which had only 84 bedded COVID beds, we had to fill up 1,300 liters twice a day of oxygen. So most of the patients require is oxygen high flow. Normally, before the corona, we never used to give 15 liters of oxygen to any patient. In corona, we give 15 liters of oxygen. So that has changed us. Now that has changed our mindset also. One more thing is non-invasive ventilator, which is more required in COVID. Invasive ventilators are totally different, which if you'll ask me is hardly 10% requirement in a COVID. More is a non-invasive ventilators requirement, which are required and which manage the patient. In our ICU also, we are managing majority of the patients with non-invasive. Hardly we require invasive. So all these patients require non-invasive ventilator. Now the problem, what Mr. Shetty was telling, is the beds. See what happens, whenever one patient of COVID comes, he occupies the bed for nearly 10 to 12 days. So your bed numbers have not changed, but your beds are occupied. Today there are 30 patients and you have 40 beds. Tomorrow more 20 patients will come, you can't accommodate them because just 30 patients are not going to go. They will stay with you for 10 to 12 days. So the numbers, anyhow we have to control the numbers. reduce the severity. The disease severity initially was too high. Now the severity has reduced. It is not causing so harm. Initially, patients used to die in ambulances. They could not even reach the casualty of the hospital. Now the patients are reaching. More of oxygen have been provided in casualty in majority of our hospitals. Like in our casualty also, we have kept 4 triage beds. We have kept a ventilator also. Till now, we have not been able to, any patient required a ventilator. They require a higher level of oxygen. So oxygen is a lifeline. Oxygen has to be maintained. Non-invasive ventilator is enough. Invasive ventilators are hardly required. I don't know, initially when the disease started, all the Chinese companies started marketing ventilators at cheap, 2 lakhs, 3 lakhs, 4 lakhs. But those ventilators had no value in COVID. What we require is higher end ventilator, because if a COVID patient requires a ventilator, his lungs are stiff. So you require a ventilator which is going to push oxygen in that stiff lung. So those 2-3 lakh ventilators don't work also. So because of no value, practically the disease is, so nobody knew how the disease is going to behave. Everybody was a learning point for everyone. Every day we used to learn from different patients. The investigations are different and the clinical scenario is different. Many times we have gone against the investigation. We have gone by the clinical scenario and the patient has come out, but the investigations were not so bad. So many things are a learning point. Another what myth has been created by the pharma companies or by the media, I don't know, regarding one injection, tocilizumab, which is something
You
40,000.
something for the television channels, I think you, and you're absolutely right on that part. That of course they played an important role in, not just because the role has to be in updating the viewer, not to sensationalize things and make them come into a fear sort of a thing. So they have to be more responsible. Sure,
So COVID patient fear kills. More than the COVID, the fear will kill.
Yes,
the fear of not getting treated because there is no treatment.
Right, absolutely right. In fact, before we let you go, a quick reaction from other panelists as well. Arjun, I want to come to you. Dr. Sharma is talking about lessons we've learned. So as a corporate, as an investor, as an entrepreneur, what has been the biggest learning out of this? And how do you think corporates can contribute more? Not in just in terms of the financial contribution that they make. What else can they do in terms of awareness? What is your take on this?
See, I want to piggyback on what Sarah was mentioning earlier also. It's the awareness and focus more on the mental health. It's not easy. The pandemic has not been easy for most of us. And it's mostly, see, the treatment may or may not be there, but there are protocols that doctors like Dr. Sharma have put in place to treat this particular virus. There is a reason why our death rate or mortality rate is only 1.9%, which is much lower than in most of the diseases statistically. Focus on mental health. Fear mongering is the worst thing that can happen. I can say even in my family, in the employees that we have, the staff, everyone were really fearful. We took concrete steps to make sure that there was communication going out from our head office to all the people that are there around the globe to ensure that there is proper protocols in place, which was sounded by the doctors and everything, second by them, and follow these protocols. Do not unnecessarily fear guide you. We have taken insurance for everyone, COVID insurance for everyone. There have been packages that have come out from insurance companies to make sure that if they are positive, they will be covered. So that one financial fear that people have, that oh my god, मेरे को अगर COVID हो गया तो मैं कैसे करेगा? So all those things have been, we are taking those steps to ensure that they can comfortably come to the working environment with proper sanitization and social distancing norms, and at the same time do not risk themselves too much. But if they are positive, they will be taken care of. On top of that, I would really want to add, and I'm completely humble about this. Doctors like Dr. Sharma, they're working day in, day out. The BMC, the nurses, the people who test, they are the ones risking their lives, going to home to test, treating patients in hospitals, exposing themselves selflessly. They are the real COVID warriors. And we, Bafna Group, would want to really salute them.
Great. So quickly, Rohan, if you could just summarize your take on the whole discussion that we had, because the purpose of this discussion was to bring out more stories. And since you're the youngest on this panel, anything that you want to say to the teenagers, to the youngsters who are watching you?
Absolutely. So I'll just share a little bit about my story then. So when COVID had hit, it was very hard because how do you fundraise in a time like this? How can you do something where you can actually help people? Because we're not doctors, we can't physically go to the places. We are quite, as rightly said, we were quite fearful of COVID. How do we leave the house by actually helping people? So we just had an idea, and that idea was that, well, how are we helping ourselves? We are using our laptops, we're using our technology, we're using the things that we have available to us, which allow us this wireless connection. It's how I'm able to talk to 5 different people right now who are in completely different places, and how that's possible. So we wanted to bring this to the students who didn't really have the ability to have this. So we managed to talk to the Lenovo CEO, and he managed to sell us now for 10,000 rupees one tablet to fundraise with internet as well, so that the students who had COVID and were able to attend their classes and they weren't able to miss anything, and the students who did also have COVID but who were struggling to come to class, who had to social distance, because of course social distancing, it's very important. So that's how we managed to do it for them. So what we also did to kind of raise more money is we continued on this. So my thought process throughout the whole thing was, well, it's impossible for me to actually go somewhere and raise money to go and do events. So how do I do it at home? So what we did was we did a Zoom charity concert about 2 days ago, and we managed to garner a few hundred people from Akanksha and it was an Akanksha charity concert. And me, along with some other very talented violinists and the Akanksha students, all were able to play for people using the violin, and we were able to raise a lot more money from that. So far, many children have, so far, I believe it's 250 tablets total have been raised for these children. And we are trying to get 1,000, because for these children, they are will be the future doctors, they will be the future entrepreneurs, they'll be the future actors and actresses, they will be our future people. And if they are all in the 8th grade and 7th grade, if they don't do their boards, if they don't study, they will not be able to get out of, they won't be able to go to higher learning, they won't be able to get their MBA or their degrees. So that's why I feel like education is really important. And so what I would like to say to all the teenagers my age and all the people out there who are trying to help who aren't doctors, and because doctors are the real heroes, how can we on the sidelines help? So I think the main thing that we can do is use the technology that's available to us, either bring the technology to them or use the technology to our advantage. I think that's the one tip I would have.
Wonderful. It was wonderful to have all of you here. And before we let you go, just would like to say, as a token of appreciation, all of these COVID warriors will be facilitated in the form of digital certificates that our team will be sending them. Thanks a lot. Thanks everyone to participate in this discussion and be part of this series on COVID warriors. Thanks a lot.
Thank you everyone. Thank you.
Thank you so much.
Thank you.